All right. So Julie is a 3-year-old female who presents today with her mother for left ear pain for 2 days. Mom states that she's been experiencing some intermittent fevers with a maximum axillary temperature of 101 degrees Fahrenheit. The aggravating factors for her symptoms are lying down. Mom reports that her sleep has been interrupted at times due to pain. The parents are intermittently controlling the pain with OTC medications. She is also experiencing some rhinorrhea, but denies any vomiting, diarrhea, or cough. Past medical history. So she was born via uncomplicated vaginal delivery at 40 weeks. She was discharged home with her parents 2 days later. She did not require any interventions while in the hospital. She has no significant diagnoses, no surgical history, no admissions, no known food allergies. She takes no medications. She is allergic to penicillin with a documented reaction of hives. She's developmentally appropriate for her age and is up to date on all immunizations. Julie lives at home with both her parents and her pet cat. Her dad is 30 years old, has no significant medical history, is a smoker, but mom states he does not smoke in the home. Mom is 31 years old with no significant history. The maternal grandmother is living and has a history of lupus. The maternal grandfather is also living with a past medical history of prostate cancer that is currently in remission. The paternal grandfather has a past medical history of hypertension and is alive. And the paternal grandmother has a past medical history of asthma and is living. For the review of symptoms, she does have some rhinorrhea. She's reporting some left ear pain. They deny any sore throat. Mom states she has not had any recent rashes or erythema of the skin. There has been no chest pain, no shortness of breath or cough. She is not experiencing any nausea, vomiting, or diarrhea. Mom states she does have a good appetite and is eating and drinking as she typically does. They deny any dysuria or urinary frequency, no joint pain or erythema. She has not been experiencing any headaches or gait disturbances. And mom states that while she typically sleeps about 10 hours a night, again, her sleep has been interrupted due to the pain. On my exam, her vital signs are, well, she's 14 kilograms in the office today. Her temperature is 38 degrees Celsius. Her heart rate is 102, and her respirators are 26. She is alert, though she is quiet and sitting in her mother's lap when I enter the room to examine her. She is well appearing, hydrated, and appears to be in no acute distress. Her skin is clear of any lesions. It is warm to the touch. She does not have any cyanosis of the lips, of the fingernails, or skin. There's no diaphoresis, and she does have good skin turgor. Her head is normocephalic. Her pupils are equal, round, and reactive to light, and the red reflexes are present. There's no ocular discharge noted. Her external ear on inspection is unremarkable and is not neither ear is tender to touch. On examination of the internal ear, the right tympanic membrane is gray in normal position with a positive light reflex. The bony landmarks are all visible and there's no fluid noted. The left TM is red and bulging with purulent fluid behind it. The TM is opaque in color with no light reflexes, and I'm unable to visualize any bony landmarks. Her nostrils are patent without any discharge, and she has no nasal flaring. Her mucous membranes are moist. She has good dentation, and there's no lesions present in the oral cavity. Her neck is supple and able to move in all directions without any difficulty or pain. She does have some enlarged anterior cervical nodes on the left. There is no redness, and these are not tender to palpation. Her lungs are clear to auscultation in all lobes. There's no retractions or grunting, and her chest rise is equal. Her heart rate is regular. There's no murmurs on auscultation. Her abdomen, she has normal active bowel sounds in all quadrants, and it is soft and non-tender on palpation. Her GU exam reveals normal female genitalia for her age. Does have good muscle tone in all extremities. She has full range of motion of all her extremities. They are warm to the touch and well perfused, and her cap refill is less than 2 seconds, and her spine is straight. So my plan for this young lady would be, given her age and lack of severe symptoms, watch and wait approach might be okay. My concern, though, with this is that it is a reoccurrent infection. So I would probably treat her. Amoxicillin is typically the first-line antibiotic for otitis media. However, with a penicillin allergy, she might have a reaction to this. I'd have to look into her chart and see what she's been given before. Since sometimes people with penicillin allergies can take amoxicillin, I'd want to see if this has been tested and if it's safe. If I decide not to do amoxicillin, if there's no evidence or she hasn't taken it before, a cephalosporin would be appropriate. So I would do clindamycin. Her dosing would be 30 to 40 milligrams per kilogram per day in 3 divided doses. So based on her weight, this would be about 500 milligrams a day. So about 170 milligrams 3 times a day for 7 days. I would also do a referral for ENT just because this is her 3rd ear infection. I'd want to rule out that there's any like congenital abnormality that might be leading to why she's getting these. I would also educate the mother that the father smoking, even though it's not in the home, could put her at higher risk to have upper respiratory infections and ear infections. So we'd want to encourage them to investigate ways for dad to quit smoking or at least drastically cut back. The last step I would do is make sure that they're doing good pain control with over-the-counter medications, since otitis media can be really uncomfortable for these kids, and we want to make sure that she was getting good sleep at night. I would review dosing of OTC Tylenol and Motrin and make sure they have these readily available to her. I would tell mom that if symptoms don't improve in 2 to 3 days to please follow up at the office. Otherwise, they should hear from ENT for an appointment. Thank you.